Ladies and gentlemen, we have two speakers that will be joining us on the stage now. And we have Associate Professor Sharon Lawn, followed by Janne McMahon O.A.M. So I'll let the ladies come to the stage. Firstly, we're going to hear from Associate Professor Sharon Lawn, Deputy Psychiatry, Flinders University. Is that correct, Sharon? Right. Department of Psychiatry, and also an acclaimed researcher. And then Janne will be speaking. And Janne is a member of the Ministerial BPD Expert Reference Group, Chair and Executive Officer of the Private Mental Health Consumer Carer Network in Australia. She's also a leading advocate for BPD in Australia. Could you help me welcome both ladies to the stage, please?
Good morning. It's very nice to be back and thinking about borderline personality disorder. I work in a university now. I've been there for about 5 or 6 years, but before that I spent about 12 or 13 years as a worker, a senior social worker in a community mental health and acute locked setting at Glenside, and before that in aged care for a long time. And that was back in the early to mid 90s. And back then I remember often sitting in teams talking about the referrals that were coming in, and no bugger would pick up the borderline personality disorder referrals. And I can very much tell you that I learnt the most from the challenges. And I certainly value and reflect back on all of those times, particularly with the clients that I did put my hand up for when no other bugger would. And it's been really good to see a shift, but there's a long way to go. Yeah. So I've got the job today of talking very briefly about carers. I care for a husband who has paranoid schizophrenia, and I can't be his mental health worker because emotionally when you're a carer, the person you love and care for does touch the buttons. So for the workers in the room, regardless of what the person's diagnosis is, carers can't do it all. They need workers to stand firm as much as they often do. So, see if I can work out how to use this clicker. Righto. Janne and I have talked to a few people over the time, and I'm sort of reflecting on the times that I've met people's carers and heard their stories. More recently I've been privileged to do a number of interviews with a whole lot of carers, and some of them are really doing it quite tough because these are people's families and they love these people. They might be challenged by them. Children are challenging in most families, especially teenagers, regardless of who they are. But what a lot of these people have told us is that very clearly, as parents, as mums and dads, they see early signs of turmoil, basically. They spend a long time trying to get help, and there are services after services that see them in that turmoil and see their children in distress, and not a lot gets done. So they clearly describe to us the behaviours that they see, the increasing distress and self-destruction that the person experiences through primary school, even in childcare, through primary school, through early high school and beyond. And it's a path that they describe incredibly clearly, but yet not a lot gets done until they actually hit mental health services. Okay? It's quite interesting. All the signs are there. So it tells you that we probably need to do a lot more in schools, a lot more with teachers. Families can't do this stuff on their own. The other interesting thing that a lot of people have told us over the time is that quite often carers don't get an explanation. In mental health, we have all these websites and we have all this information, we have all these books, and a lot of people have to do their own finding. And it's the same for parents and carers of people with borderline. We seem to think that we can just tell people as health professionals, give them a pamphlet and they'll know what it means, but mental illness is complex. It's very difficult to see someone in constant anguish and distress. It's pretty ugly to watch, particularly ugly for a family to watch, because it's the person that is your family, particularly. They're often not given any guidance, not given any counselling. Carers say they just want to know what to do to help. They don't want to be unhelpful. They're frightened that they're doing things or saying things that will make things worse. They mainly just want to make things better. The other thing that a lot of carers have told us is that, like the people themselves with borderline, that carers, they get tarred with the same brush, often in emergency departments, by services. They share the shame. They get the shame as well, as Flick has described. And so it's a vicarious giving of all of these traumas to the families, and nothing much gets done. They're often excluded from the admission process, if they even know it's occurred at all, if they even know that the person has left hospital and discharged, if they're even part of the plans for people in the care. So it's pretty important for families to get involved and to know what's going on so that they can help and not be unhelpful for the person. Often they say they don't get a response at all, and this is, when people are in such turmoil and can be so self-destructive and suicidal and self-harming, it's quite absurd that people wait for days often and get no response. When I hear that, I can only think of the conversations year in, year out that I would hear as a worker, the jokes, the black humour, the disgusting comments about people with borderline personality disorder. Mental health services has a long way to go. So I only have 3 slides, and now it's Jan's turn to tell you about the consumer experience a little bit.
Thanks very much. Look, I'm very excited about today, overwhelmingly excited. I think the whole awareness around borderline personality disorder has been essentially a consumer and carer push, both at the political agenda and through services. We've certainly been accompanied along the way by fabulous clinicians such as Dr. Andrew Shannon down there, who'll be talking later. Andrew has made himself available whenever there's been, an opportunity to talk with the politicians and the Minister for Mental Health. So, Andrew, I especially want to thank you for your support for consumers and carers on raising awareness of BPD. And I'd certainly like to acknowledge Julian Leith today, who has been instrumental in organising this day and certainly brings the carer perspective. So what are some of the main issues? People with BPD are doing the best that they can manage, and having BPD is not deliberate. People do not choose to have it. Consumers want to be treated with respect. There is still quite a lot of discrimination and stigma attached to the diagnosis of BPD. And I think it is fair to say that it's reasonably still alive and well in the main. The fact that 440 people are seated here today, and there are others in the room next door, and that there are 100 people on the wait list to attend this conference, I think is absolutely fantastic. And I think we need to acknowledge those clinicians and people in the community sector who do accept and respect people with BPD, who are affected by BPD, and who do really provide a very good level of care and are partners in that care. People want to be taken seriously. This is what consumers tell us. They don't want to be told, hey, you're not serious enough. BPD is a complex and serious and severe mental illness. You know, it's no longer appropriate that people are excluded from services based on a diagnosis, certainly not in this country. People want their concerns addressed. They certainly want access to good treatment. And as such, BPD, being a complex mental illness, really is the core business, in my mind, of mental health services across this country. Consumers want choice in treatment options. That's something that I hear from consumers all the time. They don't necessarily want to be channelled into a DBT group. They want other choices which are appropriate to meet their particular needs. People want active support at times of crisis. We know that. People live with feeling suicidal and live with feelings of or actually harming themselves in a serious manner. And I think it's more than just a cry for help. I think we need to understand that these are very vulnerable folk and that it is our responsibility to take that seriously. Consumers want more information about BPD. They're very motivated to seek help, and there's very little information out there other than perhaps what's on the internet, and that can certainly not necessarily be very constructive stuff. And people no longer want to re-experience their childhood experiences. If you have BPD, people want to know and not be treated that they're being seen as invisible, ignored and alone. It's no longer appropriate. But we need to understand that people do whatever they need to in order to ease the constant internal pain, which most consumers say to me is there. And it was interesting, Flick, that you talked about that internal pain. From talking with many consumers, it just seems to sit there and doesn't matter. Life comes and goes, but this pain is actually just sitting there. And they do whatever they need to in order to survive that pain. Others will say they actually don't feel a thing. Consumers tell me that they need to do what they need to do in order to lessen those overwhelming emotions and to regain that sense of order and to feel back in control. And as I said previously, consumers live with suicidal thoughts, feeling unsafe, depressed and anxious. So if Senator Moore was here, I'd actually put her on the spot, but she's not out of the woods. I will be contacting her afterwards. And I do really want to acknowledge Senator Moore. She's actually been a terrific friend of mental health consumers and carers, and particularly around borderline personality disorder. She's heard in lobbying her when she was chair of the Senate Community Affairs Committee, we marched up with 6 psychiatrists and clinicians marched up the hill to meet with her. She organised for us to meet with other members, other Senate members, and there was the biggest roll-up for attending a consultation with consumers and mental health clinicians. So she's played an enormous role in bringing borderline personality disorder up into the national agenda. And she heard us too. What came out of their report towards recovery, mental health services in Australia, which was tabled in the Australian Senate on the 25th of September 2008. And that called for a statewide specialised service in all jurisdictions to offer assessment, therapy offering choices, something that can support GPs, teaching, training, clinical supervision and support for those clinicians out there who are engaging in active treatment and care for people with borderline personality disorder. That service would support the metro, the outer metro, the rural, the regional areas, and would also offer areas of specialisation around BPD. So it would look at the children of mums with BPD, would look at adolescents, it would look at children in state care. Many mums find that their children are taken from them, and it's usually around the, what the health protection or the child protection authorities see as being the inability to parent their children, and I think that's a very great tragedy. We also need to look at supporting new mums to avoid that exact situation occurring. Kids need to be with their families, kids need to be with their mums, and we need to do whatever we need to do to support the mums along the way. The Senate report called for the requirement to provide specific education and training to existing and future mental health and primary healthcare professionals that aim to change attitudes and behaviours towards individuals with BPD. I think the other thing that consumers and carers are telling us is that they really want to see this national Borderline Personality Disorder Awareness Day rolled out nationally, rolled out as not a one-off event, but something to be there into perpetuity, so to speak. Dr. Andrew Janne talked about a presentation to the United States Congress in 2008, wherein the Congress declared the month of May as Borderline Personality Disorder Awareness Month. So I'll be chatting with Senator Moore and others to see what we can do in having the Australian Senate or the Parliament or whatever support the national rollout of National Borderline Personality Day. So what I want to leave with you are a few thoughts. Because BPD is a mental illness, it is a complex mental illness, it is a severe and serious mental illness, it is the core business of mental health services. People don't choose to have BPD. People do whatever they need to in order to survive. People do want to be treated with respect and dignity, and people do recover. And I think it's really important to acknowledge those clinicians out there and those services who are really providing terrific care and treatment options for people with BPD. A lot to go and a lot of work to be done yet, but I think we do need to acknowledge that. And of course, what we do want is the establishment of a statewide service. And it's really critical that this statewide service, in our minds, is established in all jurisdictions based on the strength of the spectrum model that you have here in Victoria. So I think these are terrific. BPD getting the attention it deserves, and I'm very proudly wearing this today. As I said before, I'm so excited about today. So I hope, what I want to say is that I hope that with this Awareness Day, we come to really understand the concept of no shame, no blame. Interestingly enough, Flick talked about that in hers. No, we didn't collaborate on our discussions today, but I think that's the core of everything. We heard a very articulate presentation from Flick earlier, and we really do need to understand no shame, no blame. And what I've also found with talking with many consumers and carers with BPD is that they are very slowly actually coming out and saying, you know what, I've got this diagnosis. People are coming out of the woodwork. There is a lessening of that shame. And I don't want people with BPD to feel that shame anymore. I want people to say, I have this diagnosis and I am a worthwhile human being and I am worthy of good treatment and care. And with this, I can recover, and I can do this in partnership with a healthcare professional of whatever persuasion, offering good treatment and good care and partnership along the way. I think it's really important people can recover. So thank you very much for allowing us to present today.
Ladies and gentlemen, Sharon and Janne, thank you both very, very much. Thank you.